Good afternoon, everyone. Thank you for welcome to today's China Seminar Series at the Australian Center on China and the World. My name is Xian Wang. I am a postdoctoral fellow in China Studies and co-organizer of the China Seminar Series. Before we begin, we wish to acknowledge and celebrate the first Australians on whose traditional lands we meet and pay our respect to the elders past and present. Our special speaker today is Professor Yan Long. She's an Associate Professor of Sociology at the University of California, Berkeley. She is a political and organizational sociologist whose research examines how globalization and authoritarian politics intersect in domains such as public health, civic action, and digital technology. Her award-winning articles have appeared in the American Journal of Sociology, the Journal of Public Administration Research and Theory, and Social Science and Medicine, among others. Her new book, Authoritarian Absorption, the Transnational Remaking of Epidemic Politics in China, published by Oxford University Press, has received 4 national distinctions, including the 2025 Best Book on Asia from the American Sociological Association. Today, her talk is titled Authoritarian Absorption, the Transnational Remaking of Epidemic Politics in China. So after her presentation, we'll have some time for Q&A. So now please join us in welcoming Professor Long.
Really short, thank you so very much for having me, and I appreciate the gracious introduction. It's such a pleasure to be here to share my work. Okay, so let's get into it. Okay, so infections have always been very daunting in human history, but newly emerging epidemics from HIV, swine flu, all the way to Ebola and COVID-19 have introduced the novel uncertainties into the state responses. So since Foucault, scholars always talk about like, okay, the state wanna, take the opportunity to intervene in our bodies. So state always have the desire to control epidemics. However, emerging epidemics actually define such assumptions because all of us know that the responses to COVID-19 throughout the world have differed drastically. So this is the question my book takes down. So under what conditions does a state forfeit or acquire the desire and means to tackle unfamiliar new epidemics? The state must decide how diseases shall be regulated or deregulated, which population suffering actually count as pain, and who shall take on the responsibilities to care for those infected. Ultimately, this is about the building of health institutions, which for whatever reasons have not received a lot of attention from social scientists. So in studying epidemics, scholars have widely focused on domestic factors. This is particularly true when it comes to authoritarian state. After all, regimes like Cuba, China, and Russia had a long history of using infectious disease as an instrument to achieve socialist revolution. Since the COVID-19 outbreaks, many also perceive the success or failure of authoritarian countries as a natural function of their regime type. This is always be called like authoritarian advantages. So contrary to conventional wisdom, my first book actually showed that seemingly distinctive authoritarian public health institutions might not be endogenous to the country. Instead, we shall look at transnational impact. So today I will first draw on my book, talk about how HIV responses had driven the formation of China's infectious disease control system between 1978 and 2018. Then I will use my ongoing book project, my second one, to discuss how some of the established characteristics actually continued or transformed during COVID-19. So China is actually not an exceptional case. Health officials in the global south are often caught between transnational organizations and local institutions. in the global south, transnational programs had been the largest source of funding for HIV responses. Actually, Australian government also played a role, even though US government before Trump had always been the largest donors. So you can see here, the foreign funding accounted for almost half of all the monies invested in HIV until last year. So there are two arguments from the book I want to highlight today. So first, using HIV governance as a case study, I want to show how transnational organizations have used every measure, including $1 billion to build a liberty-oriented HIV governance in China. Second, foreign interventions with the whole processes of learning and incorporating transnational rules and practices, liberal ones, did not weaken but strengthen infrastructure power of authoritarian Chinese state. So liberal interventions may indeed induce changes, but those changes are not always what are anticipated or intended. And when we talk about transnational organizations here, I'm referring to Western governments or international government organizations. So international NGOs actually do not happen. So let me quickly show you for the 40-year public health institutional building history reviewed in the book. So here is the funding for HIV interventions in China over the years. You can see China's contemporary public health had not started to develop until the early 2000s. So you can see in the 1980s and 1990s, for 2 decades, the party had completely abandoned the Maoist tradition of emphasizing public health. Back then, the concept of epidemiology had hardly existed. As its wealth grew, the state actually did not want to put money into public health. So the first 3 chapters of my book talks about this kind of unseen infectious error. Basically, the state did not want to see any epidemics, okay? And it was really not interested in governing infectious disease. So public health departments denounced the professional expertise and the technical knowledge, which hardly had any funding at the time. They treated HIV as a foreign disease undeserving of recognition, which resulted in China's largest HIV epidemics actually in the 1990s. So foreign organizations began to intervene in the 1990s without achieving many results until the early 2000s when SARS took place. In the early 2000s, they began to bring an unprecedented amount of political pressure and financial resources into so-called democratizing public health in China. So the rest of the 6 chapters in my book talks about how such interventions created sort of a seeing infectious era, during which public health bureaucracy actually expanded. Chinese health departments began to cultivate specialized capacity and professional identity. So local agents had to study and implement US-style project managerial skills, as well as epidemiology, like substantial knowledge. Departments began to increase their staffing with epidemiology, biology, or preventive medicine degree from medical school, instead of public health hygiene degrees from vocational school. So the concept of public health began to grow in China. So transnational funding accounted for you can see here, between 30 to 70% of funding for China's HIV responses in the 2000s. It also pushed the whole concept of projects, 项目, into public health funding at the time. This is very important because at the time, AIDS funding accounted for almost half of public health funding. It's very important. That's why the HIV response is so important. Even when transnational programs began to pull out in 2013, the institutionalization of projects continued. It also applied projects to tackling the other infectious disease as well as chronic disease. So transnational funding had really established AIDS as an important disease that also lasted. So nowadays, HIV/AIDS had a very low prevalence rate in China, but it has the highest mortality rate up until COVID-19. So you can see there are actually many other diseases that are much more important, okay, tuberculosis, hepatitis, but none of which had received a lot of funding and attention. So the central government continued to invest at least 30% of public health funding onto HIV until COVID-19. So in examining this whole sort of 40-year history, my book is trying to speak to a core debate in international relations and world politics. how do transnational interventions actually matter? How do foreign interventions actually matter in authoritarian regimes? In fact, transnational interventions, as you can see, regularly fail. It never goes anywhere usually. And some authoritarian states, such as Russia, had capped aid programs, foreign programs, to prevent this kind of foreign interference. But others, such as Algeria, Uganda, and even Iran, had accepted a lot of practices around HIV from foreign countries. So what makes it even more puzzling is that Chinese urban HIV negative gay men benefited the most from foreign interventions. So how the transnational rules actually flare in non-democratic regimes, especially those equipped with strong-willed state? And how did a homophobic state, even nowadays, make concessions? So foreign efforts actually to change targeted government's behavior are very old phenomena. That's why also Australian governments actually put money into it, okay? Scholars often applaud sort of international interventions into the targeted states to correct the government's non-democratic behavior. So this is what I call the corrective approach. So it's all about, for example, punishment, rewards, or monitoring on targeted states. So we talk a lot about sanctions, for example. However, governments are usually reluctant to change. So transnational organizations may work together with domestic activists to conduct interventions. This is why Chinese government always talk about 别有用心国外势力和平演变. Okay, so after the Orange Revolution, it is all about the collaboration between domestic activists and NGOs and then foreign organizations. I agree that interventions do hinge on triangular interactions between those three entities: foreign organizations, domestic activists, and the targeted state. However, actually in my book, I talk a lot about how foreign organizations push their way into China exactly because they cultivated domestic aid movement, which is a major part of this book. However, first, scholars often assume antagonism between foreign organizations and domestic activists on the one side, and then authoritarian state on the other. In reality, those entities' relationships are in constant motion and don't follow any particular script for long. The scholars also predominantly focus on one particular kind of outcome, namely different degrees of corrections manifested in compliance versus resistance of targeted states. Okay, so these days you can hear all about the current debate about sanctions on Russia, okay? How can it become like more democratic and less authoritarian? Alternatively, I actually wanted to argue that interventions don't simply impose negative corrections on authoritarian practices as intended. They can rather prescribe positive incentives, opportunities, and means for government organizations to build new behavior, and especially its kind of specialized capacities or infrastructure power in Michael Mann's words. So basically, this is what I call authoritarian absorption of foreign funding, networks, cultural rules, and organizational models to create brand new authoritarian practices. So such of authoritarian absorption can take place directly through affecting bureaucrats. Okay, it can also happen indirectly. So first, interveners may train and cultivate social movements to carry transnational practices into domestic contexts. Second, while activists push for changes, the government organizations may respond by channeling the same movement in ways that reappropriate those transnational liberal practices for authoritarian purposes. I don't know how many of you are familiar with Star Wars. Okay, so like Anakin Skywalker was trained by who? Jedi. To become what? Darth Vader. So the relationship between those activists and foreign funding are constantly changing. You can't not assume that, for example, gay man activism cultivated by foreign funding and training must stand in opposition to an homophobic authoritarian governments. Before I demonstrate this generative or model in empirical details, let me first show you my methods. So between 2007 and 2018, over a course of 11 years, I had to trace the development of China's AIDS programs through conducting fieldwork at 3 different sites. First, transnational organizations such as UNAIDS and Global Fund, which is the largest transnational entity. Second, different government organizations from health, civil affairs, security, and police. Thirdly, community-based organizations working for infected dependents, female sex workers, and the gay men in urban areas. So it's a lot of comparison here. And I don't want to bore you with all the details about archival research, ethnography, and interviews, but ethnography, participant observation ethnography is really the core of this research. And if you're interested, I can talk more about the details during Q&A. But here I wanted to show you just a snapshot of what my research site look like. You can see here, these are transnational organizations meetings in Beijing. Here is Beijing government. This was where usually I hang out with gay activists. There are also a lot of nightclubs, which I can't take photos. This one, because I don't have time to really talk about female sex workers or rural activists, that was a home of rural activists. Back then, it was a summer, really hot. And I had an open wound in my leg. You cannot see, but in this house, every inch of that wall was covered with fly. So it was really, and because it was actually a mountain of garbage right next to the house. So it was unbearable. And after just 1 hour, that was the shortest interview I've ever done. I had to leave the house. So the smell was just way too overwhelming. But I want to mind you, in that house, there were 3 children under 10 living there. 2 of them were HIV positive. So I can't talk about their stories during today's talk, but I want you to think about, okay, how many rural activists do you see here? Okay, and how many gay activists do you see in the Western world context? But I really wanted to remind you of those kind of sufferings and struggles, which we don't normally see here, would be a major part of the book. And another theme that in the book that I talk about is really the foreign agencies' operations inside China. Unlike most people think that this imperialism or whatever, their operation was very difficult. Okay, a lot of negotiation and compromises that took place when it comes to international organizations. And I think my book provides the first in-depth sort of ethnography of what their life looked like in Beijing. And I would be very happy to talk about them during Q&A. So to proceed with my analysis, I will demonstrate that transnational organizations can, in 2 ways. First, breed government agencies' interest to recognize certain disease and affected populations as worthy governance objects. Chinese government is not always interested in epidemics, okay? And secondly, foreign organizations can provide those government agencies with administrative knowledge and technical instruments to regulate such infection. Particularly, I will use the triangle interactions between those 3 identities, but only focusing on urban gay men to illustrate some of the direct and indirect mechanisms here. And I want to particularly concentrate on the period between 2010 and 2018, presenting empirical data from 1 chapter. So let me first tell you the story of Yang Ming. He had been a leader of gay community in a northern city since the 1990s. Back then, homosexuality was an absolute taboo. It was a political sort of moral corruption that the state refused to acknowledge. There was no gay man in China whatsoever. Several medical doctors who tried to study homosexuality actually ended up committing suicide. Community leaders like Yang Ming must stay in shadow, avoiding police harassment for a decade. But thanks to foreign funding and legitimacy, he co-founded a Rainbow Group to organize in the name of AIDS interventions in 2003. The group's relationship with the local governments actually had been fairly contentious in the 2000s. But the situation was completely different in the 2010s, when local health departments actually regularly supported Rainbow Group's activities. Since starting in 2014, local CDC officials actually even began to attend Center for Disease Control and Prevention, even began to attend their Gay Pride Month celebration. The Rainbow Group continued to grow. by 2018, they had units to provide not only gay population, but also the youth and the migrant population with HIV, STD, hepatitis C, and tuberculosis services. They were a very key force actually during COVID-19 outbreak. So the rainbow groups is just one example of how urban male homosexuality rose as a focus of public health programs in the 2010s. Once moral deviance to be eliminated, gay men now are a new governance category worthy of policy interventions. Furthermore, gay men organizations had become an indispensable force in China's infectious disease surveillance system in managing the problems of even the general population. So this was Li Keqiang, as you can see, everybody knows. He was meeting with a group of AIDS community leaders on TV for the first time. Most of whom were actually HIV-negative gay men. The party used this event to exhibit its commitment to infectious disease, and especially to a very particular kind of community participation-based liberal public health governance to the whole world. In front of this white lady, which was a UN representative. Okay, so this was a very unexpected change, as homosexuality has always been a very tough issue in international relations in different countries, even in countries such as Kenya, where foreign interventions were very strong. National government did not want to change their stance around homosexuality issues. So what accounted for this remarkable change? So what brought together the once antagonist, the gay organizations and the government, were projects promoted by transnational organizations. So going back to Yang Ming's examples, the officials of China CDC HIV division in the city told me, we are faced with a lot of challenges. Quote, we're faced with tremendous pressure executing AIDS projects, delivering all the indicators with high quality on time. There's 3 gay working groups in the city. We try our best to offer support. All of them, especially the Rainbow Group, do an outstanding job working for their project. They're important to our performance. Quote, Yang Ming further explained health department's dependency on gay organizations to conduct projects. Quote, you need, I think all social sciences can relate here, okay? Quote, you need people to take the condoms and pamphlets, come to the workshop, sit through the lectures, absorb all the information and fill out surveys. Those evaluation forms do not fill out themselves. Those survey questions do not answer themselves. You want to do voluntary counseling and testing, you can build a space and put some doctors there. You do not meet project targets until people walk into that door. It does not matter how many people health departments try to intervene with. Until those people give you their blood sample, you get nothing. Grassroots groups can work the magic. Without us, doing projects would be so much more difficult. So how do we unpack such collaboration? So here, transnational impact actually operates in 2 ways. Let's first look at the direct sort of mechanism. Transnational organizations had promoted, back here. Oh yeah, there are some, yes. Transnational organizations had promoted Western projects throughout the global South. I think all of us know the difference between research project versus research. A project centers on achieving specific products or outcome using certain amount of resources within a specific time frame. It frames health issues as technical problems requiring professional solutions based on managerial science and epidemiology engineering. So there's definitely the sort of difference when you work for a project versus your goal is all about conducting research. So as transnational organizations, because you need to think about the cost effectiveness, obviously, you need to think about the most efficient way to achieve certain targets rather than just think about doing the best research. So as foreign organizations contracted large-scale projects to Chinese health departments, projects actually brought a lot of financial resources and trainings to incentivize and cultivate government officers to learn transnational rules and practices. During Q&A, I will talk a little bit more about why Chinese public health organizations were willing to work with foreigners. Okay, so the US CDC and the UK Department for International Development actually had the opportunity to cultivate a whole new generation of Chinese CDC officials and experts in 2000. Back then, Chinese officials worshipped the US CDC. That was like the golden rules, okay, no longer these days. So this was very critical considering back in the 1980s and 1990s, House departments denounced professional expertise and technical knowledge since the Mao era. So nowadays, when we talk about during COVID, people criticize how the CDC were more interested in publishing papers rather than doing interventions. And guess what? That kind of professional sort of expertise and identity were really cultivated by no other but Americans. And ironically, the socialist regime quickly proven to be highly effective in producing the set of concrete, quantifiable, and immediate output specified by transnational entities. You wanted to play a number game. Guess who is the best at it? That is China. So this kind of centralized and top-down command-controlled bureaucratic systems with a very long history of producing perfect numbers really thrived in this international game. And the people always talk about, okay, like World Health Organization favor China. Okay, this was a 2 decades of cultivation of all the relationship. And China did emerge as a perfect player in this game. So not only did China consistently propose high target indicators, 指标, it was also able to meet or exceed those targets. For instance, China was one of the first group of countries receiving the largest transnational project contract of $498 million US from the Global Fund. It was the largest transnational programs in the world. So, quote, one official quoted, quote, only 20 countries in the whole world received the invitation to apply. Only 6 to 7 passed the bar. China is one of them. We're the best of the best. Since the decision was announced, we have been hosting many visiting delegations from other countries. They want to improve their performance and get more projects by learning from us, from China. Quote. So money was really not the primary motivation here. Between 2013 and 2018, when most transnational programs had already left China, the Ministry of Health formulated its own guidelines for projects and qualitative indicators. The desire to enhance their reputation led Chinese officials to strive for measurable accomplishment in front of a world audience. The Ministry of Health actually formulated a 198-page long document with even more aggressive indicators. So, as one China CDC official stated, quote, look how far we have come. We can deliver well and we can do it better. Foreign experts are experienced, but they often treat us less of colleague, like some third world amateur. China is no Africa, China is no India. We are professionals. Quote. For whatever reason, public health officials really like to make the comparison between China and India. There are a lot of competitions. Oh, wow. So the central states believe in the kind of superiority of socialism, superiority of China, has created huge pressure on local officials to achieve unrealistic targets. So local officials often compare the obsession to the Great Leap Forward, that cost millions of lives in the 1950s. Many cite it as a slogan, the crop from the field is as large as guts can yield. 人有多大胆，地有多大的产。 To describe the kind of crazy competition between local CDCs in reaching high projects targets. So how does the local officials actually make projects happen? It's not very easy, as you can imagine back then. So remember what Yang Ming said earlier. Quote, grassroots groups can work the magic. So here, let's look at the kind of indirect route of foreign organizations shape local health practices. So between 2000 and 2010, transnational organizations actually cultivated a set of very capable social movement groups with strong community connections. In fact, the transnational resources and training had helped the AIDS movement to build rare cross-national networks covering most of China and conduct professional intervention activities in their communities. So when local health departments were struggling with projects, gaiman groups grabbed opportunities. They actually began to leverage their professional knowledge and mobilizing capacity to gain recognition. Their work made urban gaiman the most important sites of projects production. In return, gaiman quickly rose to health departments' A-list governance category despite political homophobia. So here, Urban gay men organizations bridge two compartmentalized world, health departments on one side and gay men on the other side. They have completely different values, interests, and power. Here, gay men groups actually became the brokers, dealing projects through two practices. One is connecting. So let me give you one typical example. So consider brotherhood groups helping their city CDC. Their workload of typical months included 21 outreach visits, distributing 800 condoms and 120 HIV pamphlets, in addition to bring 20 of their volunteers to one training workshop hosted by CDC. They're all like numbers, okay? You need to achieve the indicators. So outreach take place usually at one bar, one park, and 4 bathhouses. And establishing relationship with those various sites took a very long time. And connecting activities means that gay men organizations must do translation and transformation work. For example, to meet the target of distributing condoms, they must change the packagings of condoms from to change it from health protection to pleasure. I observed the various strategies such as teaching money boys, male sex workers, sex tips such as pleasant ways to put condoms to customers, taking money boys on trips, hanging out with bathhouse managers, changing various things, including partnering with celebrities, in gay communities, and sending out the good-looking volunteers to the most challenging sites. Dealing projects also involve the second role, buffering practices, which means you basically separate health department from interacting directly with gay men. Consider Smiley Action Group. It was a gay organization with 3 full-time staff and more than 15 core volunteers. The district CDC testing office was its own main working space. It was a tiny 3-level building entered by a very little doorway. When I visited, a CDC staff member in a white coat was guarding the door, but he hardly even had eye contact with me. He just, later I found out, he just thought I was a sex worker. So Smiley Action Group was responsible for not only recruiting gay men and sex workers to come in to get tested, but also operating the whole testing processes. During COVID-19, we think about the sort of obsession with testing numbers that really started with HIV responses. So in Beijing, where testing first started in 2000, 18 district CDC altogether only complete less than 2,100 tests annually. But now the Smiley Group alone can provide 2,000 gay men for that one facility every year. Collecting blood samples is really not easy. And there was a competition, fierce competition to get people's blood sample. And gay men groups really take on the task and interface between health bureaucrats and the local gay population, which saves the bureaucrats the need to actually learn any new practices. What always struck me at different testing facilities was the CDC officials' role was reduced to lab work, and the gay organizations had to do all other medical and non-medical work required for each step of testing. You have to consult people, recruit them, convince them to come, and all the process of comforting them. Because the testing, HIV testing actually was fairly complicated. It involved the multiple steps and the multiple kind of visitors. And it was always the volunteers of gay men who had to do all the work. As one volunteer explained, quote, "Doctors do not feel comfortable with gays. They're therefore not suitable to working with them." Quote. Another volunteer commented how he wanted to protect gay men from interacting with CDC officials. Quote, "It's all about numbers. CDC officials look down on gay men and thus make the process so unpleasant. They clearly do not care how they make people feel." Quote. So all the officials actually in my study agree that homophobia really was a big problem. But instead of addressing it, most of them confine themselves to the technical aspects in daily operation, relying on gay men's groups to confront and navigate complicated social environments and implement projects. In fact, exactly because of buffering effects, health officials were even more aggressive in their homophobic acts. I observed, for example, the CDC official would not allow some of volunteers to use their restroom. And when the doctors when you hand in their IDs for testing, the doctors would actually use a tongue to pick out people's IDs instead of touching it. They just thought that gay men were so dirty, sex workers were too dirty. So because of gay men organizations' excellent work, they began to take on this kind of similar connecting and buffering roles for other populations such as sex workers, migrant workers, youth, and urban residents living with HIV/AIDS. They also opened up doors for other LGBTQIA movements. So one of my students actually studied transgender activism, and guess what? HIV really laid the foundation. So China actually has fairly progressive policies when it comes to transgender, much more so than the United States right now. Okay, so here, to conclude, authoritarian absorptions captures how transnational interventions to reconfigure the ways in which the state apparatus is constructed and operated. The absorption ended up integrating into state the population such as gay men and others, which had been outside the state gaze traditionally. I also contend that domestic social movements may become a key instrument through which government organizations absorb changes provoked by foreign organizations to fend off challenges and upgrade authoritarian governance. So Star Wars fans might really remember that Jedi gave Skywalker the training to become Darth Vader, but then he went back to the bright side. So here is not all sort of pessimistic views, because guess what? Nowadays, the gay organizations actually are one of the few social movements or groups still standing. And that is very important to keep that in mind. So nowadays, when we think about the China's sort of strong public health interventions or various problems, we actually need to remember that China's health systems, in fact, thoroughly absorbed two US-style doctrines. One is public health is all about disease, certain disease, rather than public health systematic sort of changes. And it was a focus on epidemiology, lab technology, and behavioral science. It was all about technical sort of solutions, along with all kinds of managerial sort of methods. So China seems to really start to echo the US neoliberal strategies, even though it's authoritarian twist. For example, the US much more emphasized the treatment, the medication, but China really focused on prevention, which is testing. So in terms of the sort of COVID-19, this is actually my ongoing new work projects. And thanks to China Journal, this was the first paper out of that project. Now we have completed the second phase of data collection, and we are ready to write the book. So there are several things I want to talk about, just very briefly touches on in terms of what HIV sort of response has really sort of continued or stayed during COVID-19. One of the things is a fluctuation in the state will and ability to see pandemics. It's very important to see things in a longitudinal views. Okay, COVID-19 was China's focus for 3 years, but overnight, suddenly, nowadays you can't even get COVID sort of test, even if the doctors see you with symptoms. So it's very important to remember that the state will and means that barely had much connection to do with epidemics themselves. Secondly, is enhancement of technical bodily surveillance. The obsession with quantitative targets, the prioritization of testing over treatment, is all about preventing. Whenever you get infected, you're done. Okay, that's not the state concern. So that really had continued. Thirdly, the neglect of rural regions in epidemiology sort of infrastructure. So in the book, I talked a lot about why foreign interventions do. It really had a lot of effects, but it really did not penetrate as deeply in rural areas compared to the urban areas. So there was a much bigger changes in terms of public health in urban areas. So the pivotal role of non-state actors in pandemic control is very important. I know many people argue that during COVID-19 was just a mass mobilization. In fact, it was not. It was really not. It was a lot of professional volunteers and a lot of mobilizations of social groups. So non-state actors was very important. And then the last one is intertwining of China's pandemic strategies with its global interaction. So public health had become, HIV interventions actually one of the key areas in terms of China's intervention and interactions with African countries, and also East Asian countries. So a lot of interactions and training programs between those regions and China nowadays. And in terms of China's sort of rising sort of global reputations nowadays are connected with its public health measures. So, here I want to talk a little bit about the sort of one thing that has changed during COVID-19, which was not surprisingly the technology of interventions. So in my ongoing projects, I talked about this kind of, even my book is about state building and success of bureaucracy. COVID-19 was a bureaucratic crisis. It was a disaster in terms of the whole bureaucratic sort of anxiety and the draining of resources. So in this new book, I also want to talk about how digital technology really didn't help. It did not help to alleviate the local government sort of problems and the handling of the epidemic. It actually added a lot of work. So I talked about the instruments of technology did not automate as we imagined, sort of gaze of the government. It didn't immediately expand its control. Instead, there was a lot of human labor, tremendous amount of work on the front lines or bureaucrats in terms of dealing with the epidemic. So this was a process of what I wanted to further explore, which is the unmaking of the state. We don't know what's going to happen for China in the future. It's very difficult to say. But if my book was written in the era when we talk about authoritarian consolidation, I think now, or expansion actually, I think that still extends. It still stands. However, in terms of Chinese government's own ability and resources, right now is going through a very tough spot. And this kind of unmaking the state doesn't mean the state will disappear or collapse, but there was certainly the reverse of efforts of bureaucratic building or expansion. At the beginning of COVID-19, the state, not the beginning, actually in 2012. Oh my God, my brain is really, okay, the jet lag is getting me. But in the first year of the COVID-19, there was a plan to expand the state control into the sort of neighborhood level. That really failed. That had completely failed. So the book talks about this kind of reverse process of making the state in terms of bureaucracy. Okay, so the broad implications of the book. In terms of method, I really want to emphasize on the organizational level. I think people tend to think of China's interaction with the world as just political. It's an authoritarian world and there's a democratic world, and they're so antagonistic, and each side sort of, it has to be either democracy wings or authoritarianism wings. But in fact, in my book, I talk about this kind of co-structure and co sort of feeding of each other and what it happens. And I emphasize that in order to understand this process, it's very important to look at longitudinal historical processes instead of just short-term events. And I think it's very important to downshift this kind of study from just international level to the local organizational sort of nitty-gritty processes. And then in terms of the conceptual sort of corrections, it's also very important to think about infectious disease control, state building, and the world order in terms of this kind of conversations. And how do we think about the civil society in the transnational perspective? One thing I didn't talk about in today's talk is that kind of the hierarchy among AIDS activists. The gay men were on the top, female sex workers were on the bottom, and the peasants were really in the middle. So this kind of hierarchical processes in terms of civil society or activist social movements are something that we need to think about instead of always thinking about social movements in the authoritarian context of this kind of rosy views. And then may the force be with us. And thank you very much.
Thank you so much, Professor Long. So we have